India is poised to transition to a technology-dominated health sector. Its Ayushman Bharat digital mission aims to develop a strong backbone to support the digital health infrastructure in the country. WION's Molly Gambhir spoke to Menon, the country head of Bill Melinda Gates Foundation, for his insights on technology in India's health sector.
Menon, India country head with the Bill and Melinda Gates Foundation, is here with me for a quick interaction on the role that technology can really play when it comes to India's health infrastructure and the global health infrastructure as well. So let me begin by asking you for the potential that the role of technology really has when it comes to upgrading India's health infrastructure particularly.
Sure. Thanks a lot, Molly. And I think I want to start by saying that technology is not like a magic bullet, right? I think you need to have a sound underlying system for technology to actually work and take it to the next level. So I think you need to start with making sure that there are adequate investments in basic health infrastructure, facilities, supply chains, trained human resources. And once those are in place, then technology can actually take the game to the next level. And I think in countries like India and I would say most parts of the global south, the real opportunity is to avoid creating some of the silos in healthcare delivery that you see in some of the more advanced economies. By making sure that you have integrated and interoperable systems, so data can flow through them, obviously with appropriate safeguards for security, privacy, and consent. I think in countries like ours, we often have to make the right trade-offs between where to put our money. I think this could just lead to a much more efficient and effective healthcare delivery system. India is poised to make a very important transition over the next few years, and I think there will be a lot for the world to learn from our experience.
Discriminate use of antibiotics and why that is such a problem in India specifically.
Again, understanding the root cause, it's often not because doctors want to write out the wrong prescription or anything of that sort. It's just often people are very time constrained. There are studies to show that later in the day the efficiency of doctors or medical health workers reduces because they'll have been through so many interactions during the day, just fatigue sets in. So sometimes it's very normal human factors because of which you may write out a particular prescription, whether for a test or a medicine. So one is, I think technology can help reduce and spread out that burden, right? Does every task that a doctor currently does need to be done by a doctor? Could some be done by frontline workers or by nursing staff or others, often collecting patient information, getting it into a system. So when a doctor comes in, it's really the way a surgeon shows up in an operation theater, right? They come in for the 2 minutes or the 30 seconds, that's the most critical. So if we are able to distribute out tasks across the health system in ways that each person does what they are most needed for, I think you'll automatically see better outcomes. The second is, like you said, I think we do need to make sure that consumers have much greater awareness of some of the medium and long-term consequences of self-treatment or often antibiotic uses because people just go out and buy it themselves, right? So I think some of that has to be an awareness campaign where again technology can play a beneficial role to start by making sure that the underlying infrastructure, the people, the supply chains, the physical infrastructure, that those exist are good, and that we're building digital technology on top of that so it really maximizes potential. And we are thinking about the needs of the last mile. We really should be designing a system that will work for a mother and child in rural India, and that will work as well for say an urban middle class person. The good thing, the ABDM is looking at an all-inclusive approach, and the idea the government has is really to create I'd say the framework that will allow a mix of public and private sector and not-for-profit actors to come together to build out the applications that India needs. We saw the benefits of India's digital health prowess and digital infrastructure prowess during COVID. While there were certainly tough phases in COVID. Many of us, lost friends and family during some of the waves. But overall, the government's response was very strong because, we had the digital platforms underneath.